Hello everyone, I'm delighted to be presenting here this afternoon on a topic that I'm very passionate about, been doing for several years now, and hopefully I'll cover everything that you need. What I want to do is cover the main dust topics, why, which dusts are the main issues, why is it a priority for us at the HSE, how people should be controlling it, what the standards are that we're expecting, so where are the particular high-risk tasks, what are the control strategies for doing those, and also to give you a bit of an insight into an inspector's view of how they approach this topic, what they're looking for, how they make their judgments. As Ben said, I'm happy to take any questions at the end, and if there's points that I haven't addressed during it. So, which dusts? When I started on this work a while ago, there was a big focus on one of the main types you'll see on the screen there, silica. And we spoke to representatives of industry, and we thought, well, we'll focus on silica because it's one of the biggest risks. And the feedback coming back was really, well, the industry and particularly the workers on the ground may not understand all the different technical terms. To them, it's dust. That's what they see, that's what they experience. And they're more kind of familiar with that term. So that's why we've termed everything construction dust. But within that, obviously, there's different types. And those different types have a significant effect on the airways in different ways. And so it's important to understand which type you're dealing with to be able to put in the correct risk control strategy. So the three main types we're dealing with are silica, wood, and what's called lower toxicity or kind of other dusts. Now, respirable crystalline silica, I'm sure many of you are familiar with this. It's really, silica itself is very, very popular. I decided to throw in a slide of my son there on the left. He's playing on a beach full of silica there. But the key thing is it's not respirable. It's not really, really small amounts. It's not really, really small. So he's perfectly safe. We're not saying you can't play on the beach. We're not saying you can't make sandcastles or anything like that. But it's important to recognise that it's in lots and lots of materials. So you'll see on the table on the right-hand side, the quantities in terms of sandstone, you've got 70 to 90%, concrete and mortar, which is really common in the construction industry, anywhere between 25 and 70%. And it's the act of breaking this material down, particularly using power tools, that releases really, really fine dust, and that's the respirable bit that you need to kind of worry about. These small particles do the damage because what happens is they get lodged in the lungs, and they're so small. When we come on to talk about masks and things like that later on, you can't always see them in normal light conditions. So if you see the picture of the beach sand and the hair, within that superimposed, you see the really, really small dots in blue. That's the kind of size of things we're talking about. What that does, it gets really, really deep into the business end of your lungs, causing scar tissue. If you imagine your lungs like a balloon, so when you're blowing up a balloon, a nice new balloon, it's really elastic, good expansion there, it holds a lot of air. If you get a similar balloon but wrap loads of sellotape around it and then try and blow it up, obviously it's not going to go as big or as fast, and that's what's happening when your lungs are being scarred. Is it's affecting the elasticity and the surface area, which is obviously having a big effect on how you can breathe. Just to see how small these particles is, the first thing I'll do is play a video of sanding, which you'll in normal light conditions. So what you'll be seeing here is obviously it's not a construction task, but it's if you just substitute wood or something else. You see sanding this car body, and bits of dust are coming off, but overall it doesn't look too bad. Put a mask on, things are looking alright. Just show me the next one, please. This is a video that's in exactly the same conditions. The only difference is backlit. And what you can see here is obviously the really, really fine dust is going up straight away. And because it's so small, what's happening is it's staying in the air. It's not coming up and straight down like heavier particles would do, which is just staying up there and lingering around. As a consequence of this, fine dust can stay in the atmosphere for a long time. If you dry sweep, it puts it in the atmosphere and then it stays there again to affect anyone who kind of walks into that area. In terms of wood dust, we're talking about mostly hardwood, softwood, other things like MDF. If you go to our website on the woodworking section, there's a really good frequently asked questions section on MDF, because we often get a lot of questions about that. It usually depends on what it's made from, whether it's made from hardwood or whether it's made from softwood, and the fact that when you machine it or do anything with it, because it's particle board, it turns into a lot more dust than it would with hardwood or softwood. So that's the other kind of main risk. We'll go into the health effects in a little bit, because this is the effects linked to it. One, nasal cancer with hardwood dust is quite rare, but wood dust is also an asthmagen. So on the left-hand side, you'll see normal unobstructed airflow with a nice big area where the air can go through. On the right-hand side, you'll see what happens when an asthmatic reaction is triggered. The smooth muscles contract, making the area smaller. You get these mucal plugs that flood it as well. So what you get is a really, really obstructed airflow. Consequently, you get all the problems with breathing and shortness of breath and the wheezing that you hear. The last term is what we really call other dusts. There's a lot of products used in the construction industry, and what we mean by these are ones that either are not wood or have very, very little silica content, very low silica content. So we're talking about gypsum in plasterboard, we're talking about marble, most limestone, those kind of things, where what you're getting is a lot of large general dust exposure, which is still bad for the lungs, however. What you can get from any dust exposure is chronic obstructive pulmonary disease. So COPD is an umbrella term that you may be more familiar with, things like emphysema, which you can get from smoking. You get exactly the same disease from just breathing in lots and lots of dust. Common symptoms: persistent chesty cough and phlegm, wheeze, more frequent troubles in chest infections, and, things like that. So those are the dusts, and kind of a broad outline of the health effects. But why is it a priority? What turns those particular issues into a priority for us? The key thing, obviously, is the health risks. Construction workers are particularly at risk from breathing in dust. There's a groundbreaking piece of research that's funded by HSE, undertaken by Leslie Russian and her colleagues, that looked into the burden of occupational cancer from past exposures. And one of the things they looked at was silica, and their estimates were over 500 silica-rated deaths in 2005 in the construction industry. So that's over 10 a week, which is puts it second only to asbestos. Other studies have looked at the link between construction workers and COPD, with a 2 to 3 times greater risk whether people smoke or not. And other research generally backs up the link between construction work and lung disease. So it's one of these areas that, although the consequences aren't immediate, all the evidence is telling us that there are significant long-term risks to people, and a large number of people are being affected by it. So therefore, it's an issue that we need to tackle as a priority. On top of that is the fact that so-called safe levels of dust are very small. The image to the bottom right-hand side of the penny, the silica next to that is the maximum limit after the right controls have been used. It's not a safe limit, because there's still a risk of getting silicosis at that limit. To put it into context, that kind of 0.1 milligrams per meter cubed, which is what that represents, that diagram, is the same as the maximum amount of arsenic that somebody's allowed in a day. Now, personally, I wouldn't want to have any arsenic. I prefer to stay well away from that, and the same with silica. Just because there's a limit there doesn't mean to say it should be met. It's the maximum legal limit after the right controls have been used. And while wood dust and other dusts are higher, we're still talking about really, really small amounts. So it's high, there's high risk and high standard controls are expected because of that. Now, while those limits are typically, if you're working in a manufacturing environment, you can apply those all day. So what you'll do is obviously you'll go and do your sampling, and if you're working in a brick manufacturing example, you can get an average of what, for example, the silica exposure is throughout the shift. Construction doesn't, as you'll know, doesn't work like that. What you'll find is someone will be doing a short task for 5 minutes, say, and then might not be doing any other cutting for another 2 hours, and then they might do another short duration task. So as a rule of thumb, what we say is you shouldn't really exceed, if we use the silica example, the 0.1 by 3 times over a 15-minute period. But what we find is that many construction tasks that are short duration have very, very high exposure peaks. And what we'll just do now is play the video. It shows you that in kind of real terms. So what we've done is we've equipped this guy with 2 measuring devices. One measuring device measures the silica in the air on the sampling pump. The other device is a light scattering meter, which measures how much particles are in the air at any one particular time. What you can then do is calibrate how many silica particles are in the air at any one time. On the graph on the right hand side, what you'll see is at the bottom is the kind of 0.1, and as you can see already we're significantly above that. So as we continues to chase the wall, what we do is we're putting a very, very high amount of exposure. You see in the dust lamp to the left hand side there as well how much is showing up. Although obviously the health aspect is the HSE's main concern, there are other things to consider as well. The second thing is the image of the industry. The government strategy on the right there, Construction 2025, is the overall strategy for the construction industry, and it recognises that the industry faces a couple of problems. The first is the image of the industry. It doesn't necessarily attract everyone it needs to. There's a skills issue, skills shortage issue, and there's a skills retention issue. So anything can be done to improve the image of the construction industry is bound to help that. And an industry that's seen as dirty, dusty, and not very good for your long-term health is not a positive image, so we need to change that. There's also the issue of corporate social responsibility for larger companies, and reporting of those, particularly if they're listed on the stock market. There's a CSR section in corporate accounts. So there's positive issues there in terms of making the case. In terms of environmental issues, this guidance here on the assessment of dust from demolition construction addresses it from an environmental impact. Soiling can cause, dust soiling can cause ecological damage, can also cause air pollution. So particularly in cities like London, where they're very keen on reducing the amount of particulate matter in the air, what you'll find is a lot of the controls that they're saying must be used for controlling environmental pollution will be the same as we're saying in terms of stopping it getting into the air in the first place. The last reason is a positive case as well in terms of the immediate cost benefits. A lot of these pieces of kit, as you know, are expensive. I couldn't believe the price of a cut-off saw when it first started. And these things are a rather heavy-duty piece of kit. They don't like having lots of dust in the motors and things like that. They're not designed for it. It's like buying a really, really expensive car and just putting rubbish in the engine and never putting any oil in and all those kind of things. You can expect the life expectancy to go down if you don't look after it. So, some of the manufacturers say that you get increased life of the tools and the blades from going dust free. You also get quicker application speed. For one thing, you can see what you're doing, and things are cutting more efficiently. for a start. Clean-up time. I know, speaking to a lot of contractors, that clean-up time takes a lot of resource and also adds to program costs and all those types of things. So if you can get rid of that at the point that it's the task being done, then so much the better. And also it's a happier client, happier neighbours. It's a common complaint for certainly domestic people getting work done about the dust going everywhere. These are steps that can be positive steps that can be taken to say, well, look, it doesn't always have to be this way. So those are the areas about why it's a priority issue. I'll try and give you a more rounded picture than just the HSE aspect, but the other areas that we can bring into it as well. What I want to go through now is really the principles behind how to control the dust risks, and also these equally apply to other health risks as well. The first thing I'd really like to do is direct you to our website. So put a lot of time and effort into revamping the health content on the website, so that it all follows a consistent principles. You see on the top left there, we're talking about assessing the risk, then controlling the risk, and then reviewing what people are doing to see that it's effective. On the right hand side, that's all put into a flow diagram with some key points, and all of that's explained on the website. So there's a managing essentials bit which goes through all of those areas in detail, and then there's topic specific elements, which, so for example, if we're talking about cement, we'll go about where is the highest risk and how to assess that, what are the particular controls you should be doing, and how they should be reviewed, including any health surveillance elements within that. So hopefully, by following a common framework, you'll be able to see how all that fits in. That's what I'm going to go through here now. First thing is identifying high-risk tasks. So those 5 areas that are bullet pointed are the key things to think about. The first is the material. As I mentioned before, is it a high-risk silica substance? So there's going to be a big difference if you're working on sandstone compared to working on limestone from the risks. There's also going to be a significant difference if you're working on pine compared to western red cedar, because that's a really powerful asthmagen. So it's all about knowing the toxicity of the substance that you're dealing with. Second is the task. In general terms, the more powerful the tool you're using, the worse the risk is going to be. Doesn't mean to say that using hand tools can't be bad, because, for example, in stonemasonry is a separate issue. But usually, the more powerful, the bigger the problem. Third area is the work area. There's a common misconception that if you're working outside, everything's not so bad because the wind will blow it away. You can still get really, really high exposures outside. But it's even worse inside, because obviously there's less ventilation and the dust levels can build up quite significantly. Time, this comes back to the stonemasonry example. If you're using hand chisels all day long on high silicon containing substances, that'll be a risk because of the duration. If you're doing it for 2 minutes, that's not going to be a significant issue, but if you're doing it for 8 hours, then it becomes more of a significant issue linked with the frequency. And the issue with construction workers is because they're not doing one-off cuts, this is likely to be something they'll be doing throughout their careers. The risk builds up over time. Part of the assessment also is about involving workers. It's really important to involve workers on everything to do with health and safety, but health aspects in particular, because, as I mentioned before, the long latency nature of these diseases means that they're not going to see the effects straight away. So what that means is it can become almost tomorrow's issue, and I'll deal with that tomorrow. And eventually tomorrow does come. So it's important that they understand up front why they need to use the controls, particularly for things like masks, which can be uncomfortable and restrictive to wear. Why it's important that they need to wear those, when they need to wear them, and what the benefit is for them, because ultimately at the end of the day these controls are about protecting them and their colleagues. Once you've assessed the high-risk tasks that you do, and I'll go on to show you some guidance later on where we've tried to assess some of those high-risk tasks for you. Obviously, the next stage of the process is to control. And I'm not going to go into IOSH in any great detail. But what I want to do is just to re-emphasise a couple of key points which fundamentally underpin the control solutions that we advocate and why we advocate those. Obviously, the first duty in the hierarchy is to prevent exposure. That's the overriding duty. It always comes first. Within the website and some of the examples I'll show you, we always stress that first. Not always possible to do that, so where you can't do that, it's about this adequate control. And what that means really from our perspective is the higher the risk, the higher the standard of control that is needed. And some of the tasks which I'll come on to have got a significant risk that a really high standard of control is needed. So that's why you'll see somebody needing water suppression and a mask, for example, just because of the high risk nature of the task means that backup control is needed as well as the main control. I know that most of you will be familiar with this, but it just really highlights why that's the system we use. In the bottom left corner, if you eliminate and reduce, the likelihood of things going wrong is very, very low, and the amount of spread is very, very low from any of the dust getting in the way. Once you get to control at source, a number of things can start to go wrong and you can get spread. Once you rely on RPE, everything can go wrong and you've got spread everywhere. So that's really why we're kind of stressing that as a backup control. But I'm sure you, and well, certainly I've seen RPE as often the first and sometimes only control. And that's why we're trying to re-emphasise the other issues here. So in terms of practical examples for elimination, the example there on the left is where it hasn't been designed out. So you'll see the area of paving with the drainage channel down the middle. I'm sure on the design diagram that looked nice because it was probably equidistant between the wall and the edge of the paving. However, in reality, when it came to laying that, the poor old contractors had to cut every single one of those. So not only is they've got a dust risk there, which they've had to control, there'll be a noise risk, there'll be a vibration risk, and it's probably taken a lot longer to do as well. If they'd have just been able to shove it 4 or 5 inches to the left at that gap, and maybe would it really have made that much visual difference? In the middle is shot firing. That's an alternative to drilling. On the right hand side is a block splitter, so that takes away the need for using cut-off saws. It's quick, there's no noise, there's no vibration, there's no dust, so it's a really simple solution. And on the bottom right hand corner is an example of where they haven't chased out. What they've done is they've overcovered the cables prior to boarding, and all they've had to chase out is the back boxes. So what they've done is they've significantly eliminated the amount of dusty tasks that they've had to do there. So those are types of practical things that can be done. But obviously, there's a lot of products on site that do need to be cut or sanded or shaped, or for whatever reason. And for that, what we kind of say is that if you have to do that, the best, for the reasons I've already described, is controlling its source. The first way of doing that is water suppression. I'm sure most of you are familiar with this. What I want to do is show you a video of how it works in practice, though, in terms of reducing the dust levels. So the first video I'll show you is similar to the earlier one, with the chart on the right hand side. And what you'll see here is that's all the visual dust, so the general dust. It's slowly the respirable dust silica gets into the breathing zone, and you can see how high that's going up, how significantly the exposure levels are. Really, really significant exposure levels there in a very, very short period of time. What we'll do now is show you exactly the same, but with water suppression in use. So we go with the water bottle, which is more or less a one-person job. You'll see on the right-hand side there's a dramatic difference between oxygen going in the air. It's not silica-free. It's very difficult on the scale of when this scale is so large to show how much silica is there, but there's still, it probably kind of controls about 90% of the silica. And because the worker's standing over there, anything that's going off, it's not captured by the water, it'll still be in the breathing zone. We also know that water suppression can fail, so that's why the RP is needed as a backup control. Just want to cover a few kind of practical issues associated with it. Flow rate, we say for water bottles, for example, it's about 0.5 litres per minute. Anything under that, you start to not control things properly. Over that, you're not getting any extra benefit. All you're doing is making more slurry and emptying the water container quicker. Water supply is a key thing, particularly where portable bottles are being used. It's fine when the bottle's full, but those can empty quite quickly. So what's the operator going to do? How are they going to refill it? What's the logistics behind that? There's devices such as top right, which are larger powered devices which hold a considerable amount of water. I think that one there can run 2 cut-off saws off it, so you can have a couple of people working at the same time. But they can produce a bit more water, they can kind of flood it, so you've got to manage the runoff with all of this stuff. It's about planning and thinking about it, where you're going to do the work to manage those kind of issues. The last thing is marking the cut line. It's an excuse that I used to hear in terms of, well, I always mark with chalk, and I use water suppression and I can't see the chalk cut. On the bottom there is an example of a paving marker, which is semi-permanent, and you can see it through the water. So there are devices available that you can use. I know that most of you will probably be familiar with water suppression, so what I want to do is concentrate a bit more on tool extraction. As this is an area we've been progressing for a number of years now. Because when I first started this, on-tool extraction wasn't really used at all. Didn't really have any guidance for it, and we've come a long way since then. The important thing to think about it is a system. It's not just an extraction unit. It's a lot more than that. So the first thing to think about is the tool. On the bottom left-hand corner, what you've got is a sanding pad. With the pad in the background, has got a number of holes you'll see there. That's to make sure it's got enough air going through it. But equally, the actual abrasive surface which sits in front of it, you'll see it lying on top of the white paint, that's got thousands of micro holes in it. So in fact, if you were to see it up close, it's just full of holes. And what that allows is a really good rate of air to flow through and take the dust with it. Obviously, you can have the most powerful extraction unit at one end, but if you haven't got the right airflow at the tool part, it's not going to work. The middle photograph shows what's called a capture hood. What that basically means is something that sits over the cutting disc or the blade or whatever it happens to be that stops the dust from escaping everywhere. Because again, the most powerful extraction unit, but if all the dust is being propelled in numerous different directions, it's going to be very hard to control that. So what that does is kind of funnel it towards the tubing, which then connects to the extraction unit itself. Now the extraction unit, you need to be a savvy customer for these kind of things, because it's not about getting a domestic unit and attaching it. These are complex and sophisticated bits of kit. For silica and wood dust, what we say is you should be using an extraction unit that meets the H or M class standard. So on the bottoms you'll see those stickers there. If the unit has those stickers, it'll meet that standard. So it's a really easy way of differentiating and determining whether you've got pieces of kit or pieces of kit on site that meet the standards that we can specify. There's a couple of things to know about these pieces of kit. They have alarms and things like that. What I'll do is I'll try and play you a couple of videos first to show you how effective they are, and then we'll go on to discuss some of the associated issues with them. So again, what I'm going to do is quickly replay you the wall chasing clip I showed you earlier, just so you can refresh your memory about how much dust was in the air during that process. So there you see significant peaks. And what we'll do is we'll play it now with on-tool extraction on. Now you can also see a very visual difference there. The dust lamp in the back is hardly picking up any dust. On the right hand side, what you'll see is that there is still silica there. Although it's much lower levels, it's not 100% effective. And that's why we've got that again. Why we've got the mask as backup control measure. So these are the kind of things you need to be thinking about. First of all, H&M extraction units have correct airflow, so they're designed to meet a minimum flow specification of 20 meters per second, so to remove that dust as fast as it's created. The second thing is they've got indicators for problems. So examples, so some of them have got inbuilt alarms, so if the flow drops, an alarm will go off and you know there's a problem. They also have cleaning mechanisms, so that if there's a problem, there's a way of getting the dust off the filter. If you use one of the common problems with extraction units or using kind of general vacuums is that tools can produce a lot of dust very quickly, and what that does in the filter and in the bag is produce what's called a dust cake, which basically clogs everything and stops any air getting through and expelled through the motor, so everything just seizes up. These have self-cleaning mechanisms. So if I just play you a video of that in operation. Now what we see here is also not designed to work with tissue paper, but what you'll see is that all of the tissue paper is stuck on the filter at the top. Now the pulse has been reversed. Now we're simulating a blockage. What you hear is an alarm which indicates the person has a problem. The bellows, the filters there are blown the other way to clear that blockage. So as I say, these are sophisticated pieces of kit. The other thing to be aware of is that I've known some contractors have gone for an H extraction unit that's used in asbestos work. Obviously, it's a clean unit that they bought that could be used in asbestos work and used it with this type of application. And what you find with asbestos, those kind of H class machines, is that the filter is what's called an arrestor filter. So the bits kind of stick in it. Now this unit here has one of those arrestor filters, but it's also got other filters in it. So what happens is the air, the heavier bits fall into the bag. There's a pre-filter here which takes out most of the dust, and then the final filter up here takes out the very, very last bits of the dust. If you don't have, for a HEPA filter, using these kind of asbestos vacs, if you don't have this pre-filter, what you'll find is the dust sticks in the filter and because so much is created, it gets clogged up really, really quickly. These machines also have what's called high filtration rates. So what you don't want is to be collecting dust and then for all that dust to be put out the exhaust port, because the air is taken through the filter over the motor, and then that kind of expels the air. What you want to do is capture it, and these have high efficiency capture filters on them, and they also allow for the safe disposal. Obviously, you don't want to be capturing all that dust and then just tipping it out in a skip or something and then be exposed. There's quite a few kind of things to think about. The other thing to think about is that all LEV requires a thorough examination and test. Now, we've always done this for fixed LEV, but I think it's going to be a common practice not to do it for on-tool stuff. We've worked very hard with the tool manufacturers and the hire industry to develop a process that can be done for this type of kit, because at the end of the day, even if it's regularly maintained, it's important to ensure that every so often it's given the adequacy of control that you're assuming it's got, and that's what a thorough examination and test is designed to do. So what we've done is we've designed very, very simple tests which only relates to the extraction unit itself. The details are there on that website, which details really why you need it and how it can be done. And what we've tried to do is and I think we've succeeded, is getting a really, really simple but effective test that's fit for purpose, but doesn't involve anything that's overly complex. Lastly, of course, as I've already mentioned, for several tasks is RPE. Just before I do that, what I should say is that for these H&M class, we'd expect those for wood tasks and silica tasks. If you're doing other dust tasks, such as gypsum, you can get away with an L class, because the risk is lower. But for silica and wood, we'd be expecting an H and an M, or an M. I mentioned that they're not 100% effective, so RPE is still needed for some high-risk tasks, and what we've tried to do is give guidance on where that is the case. Probably out of all the things that I get asked on dust, RPE is probably the most frequent and the most varied questions. The two things we stress is it's got to be the right type and it's got to fit the user. So for all silica jobs and a lot of wood dusts, we'll be expecting a protection factor of 20. So that means a disposable FFP3 or a Haas mask with a P3 filter. For some other tasks, with lower dust tasks, you might be able to get away with a P2, but for a lot of tasks, it will be a P3 or an FFP3. The key thing about face fit testing is that the dust, as I showed you earlier, is in some of it will be so small it can fit between any gap. So you'll see on the nose there, what we've got is a roofer who's cutting roofing tiles wearing a mask, thinking they're being protected, but obviously they won't be, because as you can see there's a crescent of dust, and what's happened is that the nose bridge of the mask hasn't fitted properly, and all the dust's escaped there. It's fogging up of glasses, of goggles and safety glasses and things like that is also another common indication there's a problem with the fit of the mask around the nose. Face fit testing is expected for all masks, because at the end of the day, even if it's capable of doing the job, because it's got the right specification, everybody's face is different. So you've got to make sure that it's capable of providing the individual with the protection, because it fits their face properly. On the right hand side there is a video or the packaging for a trilogy we produced, which shows how RPE works, and what inspectors are going to look for from an RPE program, and also how somebody's implemented an RPE program. And it's got there, you'll see in the picture, there's a fake head, and within that it's got videos that show how a mask can look right, but in the lungs below that you can still see material entering the lungs. So it's really good visual demonstration for toolbox talks and things like that. And lastly is reviewing. You'll be familiar with for all of these about having work procedures, maintenance, supervision, health surveillance, things like that. So I'm not going to go into that in detail, but they're just the standard things you'd expect from any kind of safety management system. So those are the DUST, the control systems we advocate. What I want to try and give you briefly now in the last 5 minutes is an inspector's view. We did a health initiative in 2014, looking at larger sites and how they managed health risks. Dust was the most significant enforcement area within that. Asbestos was excluded because it's covered in other topics. So you'll see that 9 out of the 13 prohibition notices were issued were on dust, and 42 out of 108 improvement notices were issued on dust, with all the reasons listed there. So incorrect extraction, RPE mistakes, dry sweeping, people really not knowing what they're doing. So a significant amount of enforcement. And that really replicates last year's refurbishment initiative, where it was, again, the most significant health area, but after asbestos, because that was included in, obviously, as part of refurbishment. And again, the statistics from that. So inspectors going out there are commonly finding issues and taking action on those. Those actions are based on our enforcement management model, which this is a screenshot. The left-hand box, you'll see serious personal injury. These dusts cause lung cancer and COPD and other things which we equate to serious injury. So that's the same category as falls from height. And what that means is that if you haven't got the right controls in place, the risk gap can be quite large between the likelihood and the consequence of between where you are and where you should be. And the bigger that gap is, means the more significant the enforcement action would be. What we've done is transferred all of that into operational guidance. So if you go onto our website and type in construction dust operational guidance, you'll get that link at the bottom right hand side. And what that does is it kind of explains, or it gives guidance to inspectors what the initial enforcement expectations should be for various situations that they might find. And it mirrors the guidance that we've produced on our website in terms of tasks. So, for example, curb cutting in our website, which I'll come to in a minute, we've got the guidance for what people should be doing. And in this operational guidance, it says what's the appropriate course of action where that isn't being followed. So it's all transparent and consistent and targeted and proportional. As I mentioned, here is our guidance. On the right hand side, you'll see there's specific action on construction dust. As part of that, there's dust specific tasks. So you can see there's cutting roofing tiles, chasing concrete, dry sweeping. With a lot of those, we've got embedded videos. So some of the videos I've showed you today, some of those are embedded there and downloadable from there as well. Two guidance documents I'd refer you to. On the left is what's called CIS 36, Construction Information Sheet 36. The key point of that is on the back, where it's got a table. It's got a table that sets out a load of common tasks and what we consider the right control levels are for those tasks. The document on the right is CIS 69, and that really details on-tool extraction. We're not the only ones producing guidance on this. Construction Industry Dust Partnership is a really broad range of bodies, including IOSH, who are supporting it. It's hosted by the CITB, the website there. So for other advice, toolbox talks and resources, that's another area to go to. And as I mentioned, IOSH have been supporting us on some of this work. They conducted a construction dust survey for us, which will be a really valuable benchmark in 2 or 3 years' time if we measure what progress, it allows us to measure what progress has been made. And also then No Time to Lose campaign, which silica will be an upcoming issue in the future. So that's all the issues that I want to cover. I'm now happy to take any questions that there may be. see a few people are typing, so just wait till a few of those questions come through. We've got a question there from Mark McLaughlin. He says about the M-class extraction units. They're specifically for the high-risk substances. So we're talking about any wood that's being used on site or any silica-containing product. That's the minimum we'd expect, so an M or an H class. Some of the M-class units are smaller and more portable, but on the other side means they need emptying more frequently. If you're not sure, a good way of doing it is to go to a hire shop and test a few different models for your particular tasks, and that will enable you to kind of see what works well for you, what the potential issues are, and then go back to the manufacturers as well. I've had another question about face fit testing and particular masks. I'm not going to go into particular manufacturers, but in terms of the techniques that we recognise, it's the qualitative or the quantitative. So either the Bittrex kind of test with the bag over the head, or something like the porter count. Those are the only face fit tests that we recognise as being adequate at the moment. Another question about standard for tool extraction. As I say, if what you really want to look for is those M&H stickers. If it doesn't have an M&H sticker, it can't be there's a BSEN standard for on-tool extraction kit. As part of that standard, they have to have those stickers fixed. If they don't have the stickers fixed, then they won't meet the standard. So it's a very, very visual way of being able to see things. Question on what does the M stand for? It stands for medium. I think low, medium, and high hazard. But if you look at the standard, what it says is that for wood dust and silica, it should be at least M class. So we've just transferred what the standard says into our guidance. Question about whether I'd advocate the use of H or M class extraction in place of sweeping dust. Definitely. That should be the first port of call, is obviously to try not to create it in the first place. But if you go to our website, there's one of the task sheets there is on dry sweeping, and you'll see a couple of video clips that are very, very similar to the ones I played you about with real-time exposure. And with dry sweeping, you see you can get a significant amount. And what's really happening is you're just putting it up into the air, and then it will settle again later. So the question is how much you're really removing and how much you're putting back in the air for other people to breathe. So kind of using a vacuum attachment on an extraction unit is much more effective. Question on, is there any work with tool manufacturer suppliers on this? Yeah, we've done an awful lot of work with them on this. 3 or 4 years ago when I started work on on-tool extraction, we had very little guidance on it. So I've spent a lot of that time working with the manufacturers and the hire association on getting the guidance right. So the CIS 69 document that I referred you to on tool extraction was written in consultation with manufacturers and hire companies to make sure that we got the right information out there and it was consistent, that they all bought into that. With regard to face fit testing, there is a question about whether you expect the principal contractor to have a face fit testing kit on site, or whether having a competent person visit site as needed is acceptable. There's a couple of issues here in terms of who manages the risk and who is responsible for managing the risk. The primary duty for managing cost risks rests with the duty holder that creates those. So if, for example, we've got a groundwork contractor who is cutting curbs, their management, their organisation needs to make sure that they've got the face fit testing done, and the lads have got and the workers have got the right masks. For the principal contractor, what we're saying is that you need to make sure that you're employing people with the right levels of skills, knowledge, and experience coming onto your site. So, as part of the assessment process, have they got those face fit testing procedures in place? And can they demonstrate that that's working? Wouldn't necessarily expect everyone to be turning up on site with a face fit certificate, because at the end of the day, that's for that duty holder to manage and for you to have oversight to make sure they've got a system in place. In practical terms, I understand there's a real issue with agency workers, sometimes turning up on site and not having face fit tests and having to get that done quickly to get people working. The main thing with face fit testing is making sure the person doing the testing is competent. There's no point having a testing kit on site if people only have a rough idea of how to use it. You can get it wrong with a number of misunderstandings. So it's about having a competent person using that kit as and when they need to do so. If there's somebody on site who can do that, brilliant. But it doesn't mean to say it has to be someone on site, as long as the person knows what they're doing with that kit. A question here about what about old units with no HRM stickers? Are these new? Not as far as I'm aware. These standards have been around for a while. So those kind of things that we would expect on sites, and certainly the guidance has been out now 2 or 3 years. So we would certainly be expecting HRM standard on site. One of the questions is asking about a slide at the beginning relating to figures from 2005, and are there any further up-to-date statistics? The study that refers to is a very complex study based upon a number of statistical analysis and various elements like that. 2005 was taken as a reference year. It's not possible to kind of redo that study every year to produce up-to-date statistics every time, but it's a good benchmark indicative figure that's used based upon a whole body of kind of research. So the short answer to the question is that there's nothing that's been produced that's more up to date, because the only kind of figures we get reliably for ill health are things like asbestos, where there's a definite cause and effect that's only attributable to one particular substance, whereas some of these lung diseases either get misdiagnosed or kind of confused with other things like smoking onset and things like that. There's a question here about what training would we be looking at from an individual that would deem them competent. I presume that's relating to face fit testing. It's a bit more than some of these kits have DVDs that come with them. It's a bit more than that. Remember that it's not about ensuring just the right fit. It's about ensuring the right mask, and there's quite a lot to it. So there's an industry standard called Fit to Fit. If you go on their website, there's FIT #2 FIT. That's one way of being accredited if you want, but we don't say that you have to be accredited. Our advice would be to seek information from the manufacturer. not just to rely on the DVD, because there's a wider and deeper understanding we need of. There's a question on, are there any figures for ill health recorded and members of the public exposed? Not that I'm aware of. One of the key things to think about is that these are long duration disease, long latency diseases. There's very few examples whereby you can be exposed on a couple of occasions and get a severe lung condition as a result of them. Some of the exceptions are things like Western red cedar, which I mentioned earlier. That's a really powerful asthmagen, and that may be one example where somebody could get a reaction unexpectedly quickly. Things like silica usually take 20, 30 odd years. You can get acute silicosis, but again, that's being exposed to very high levels of silica over 2 or 3 years. Normally, we say that for members of the public, the odd exposure is not an issue. It's not pleasant. It's not nice. We're not disputing that. But in terms of risk, because they're not working in the construction industry in general, they're not being regularly exposed to it. So it's that long duration of exposure over many years that's the real issue. There's a question about, could I clarify whether the HSE recommends as a manager we know how to face fit test for auditing and control purposes on site projects? Not necessarily. I mean, I've been face fit tested, I've seen some of the instructions, but I wouldn't do it myself. But I would still say that I'm competent enough to know when it's being done well and when it's being done wrong. But I think there's a difference to following the test, because there's very, very specific steps and very key elements to missing it out and knowing what's involved. And I think, you need less, you can make a quicker assessment on where things are going wrong. So I think as a manager, you need to be aware of the issues, aware of what the key points are, but I don't think you need to go through that training yourself. We might have one more question coming in, and then we'll looking at the time, call it to a draw, bang on 2 o'clock. All right, last question is about RPE, face fit testing and employee cooperation. How far do you expect employers to take the issue of facial hair? This comes up very regularly. It's a control measure. At the end of the day, a mask will only work if it fits a person's face. And what happens with stubble and beards is it pushes, acts as stilts and pushes the mask away from the face, thereby breaking that face seal. And as I showed you earlier, the dust is so fine it will exploit those weak points, and people will be exposed. There are alternatives for people who have beards, powered hoods and things like that. So where people have always had beards or have beards for religious reasons, or there's the other issue though is where people say, I've got a stubble, I just can't be bothered, but effectively I can't be bothered to shave, so I'm not going to do it. At the end of the day, it's a control measure, and it's the same as somebody saying, well, I'm not going to work safely on the scaffolding. The kind of options are, if someone needs to do a job safely, they need all the right equipment, and so it's a kind of a contractual issue. If they're employed to do that job, they need to be using the right equipment, or else maybe put them on a job which doesn't involve those dust generating tasks, where they're not going to be exposed. That wraps things up for today. Thank you very much for listening. If any questions continue to come in, I'm sure they'll get forwarded. But thanks once again, and all the best. Bye.